Hello, my name is Dan O'Drea. I want to talk to you about plasmapheresis. Plasmapheresis is the process of drawing plasma and then turning that plasma into different medications and treatments or therapies. I want to talk to you a little bit about how they draw the plasma, and then I'm going to go more in depth into what they get from that plasma, what treatments and medications they get from that plasma, and what those treatments and medications treat. Anyways, though, I am a donor. I donate ECHED plasma twice a week. ECHED plasma, they will hook me up to a machine. And by that I mean I get injected with a needle that draws blood from me and it goes into a machine or the blood goes into a machine that goes into a container. This machine is a giant centrifuge. It spins really fast, and the plasma, which is in your blood or bloodstream, is lighter than the red blood cells, and so it separates. Um, it separates the top, which is when it gets collected, and then the blood gets transferred back to you. So the only thing that's taken from you is your plasma. But anyways, this process goes over and over again until you donate a certain amount. And depending on that amount is how healthy you are, how hydrated you are, and your weight. But anyways, once they get this plasma, they are able to derive many different medications and therapies from it. It's not just if you donate one time, they only get one product from it. I think this is very interesting. It's kind of like crude oil. You don't just get one fuel from a barrel of oil. It's the same thing with your plasma. You don't just get one medication or one therapy from each donation. You can get multiple. The different type of proteins and therapies you can get are, which are not limited to, but these are just some of them, is alpha-1 proteinase inhibitors. You can get C1 esterase inhibitors, coagulant factors, and immunoglobulins, and other proteins and factors that will help a whole bunch of other people. But there's this agency out there, the Plasma Protein Therapeutic Association, PPTA for short. They do about 80% of this in the United States. Um, they they're where your plasma goes to, and they are the ones who separate out and change it into these different medications and therapies, which is really important because anyone who is taking these different treatments, most likely, unless it's an injury that you can recover from, most of these conditions they will have for the rest of their life. So it's not just a treatment regimen and then they're done. It's for the rest of their life. And some of these, or most of these, are multiple treatments. For instance, there's a hereditary disorder that gets treated by the alpha-1 proteinase inhibitor therapies that attacks people's liver, and it just shuts the liver down. But with this therapy, they can lead a healthy life. However, they need a constant supply of this. They need up to 900 donations, 900 single donations a year. That's just for that one person. But there's plenty of other things that plasma goes into. Any type of bleeding disorder, the coagulant factors help out with that. There's different conditions to where people have bled into their joints, and with these inhibitors and these therapies, they're able to get these coagulant factors and not bleed through their joints. And any type of immune deficiency at all, and this goes from if you're injured like a burn victim or something, this goes to premature babies, to cancer patients, to anyone who has COVID-19 is a huge factor right now. Um, Anyone who has an immune deficiency is probably going to get some sort of plasma treatment. And there is an untold number of people who need this. So the supply is always needed, and it's not just, oh, I did it once and I'm good. The need is there, and because the need is there, however, there is a great motivation to go to help other people, but also these agencies like Kid Plasma are able to compensate people. I myself, with the way that I donate and how much I donate, I make over $700 a month just for 4 hours a week. So I don't just do it for the money; I do it for the people. But no one doesn't like money. So the money is definitely a little help here. I mean, that's a pretty nice chunk of change. But anyways, if you want to know more about plasmapheresis, I hope you're able to read my paper and I'll go more in depth into it. Thank you very much. Bye.